Welcome to a presentation about chalazion brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. A chalazion is like a pimple on the eyelid. It is caused by a blocked oil gland in the eyelid, just like a pimple is caused by a blocked oil gland in the skin. The difference between a chalazion and a pimple is that the chalazion is deeper under the skin and can be more painful. It can also take longer to heal than a pimple. A chalazion is a small, painless lump that can form on the eyelid. Common symptoms of a chalazion include swelling of the eyelid, redness of the eyelid, tenderness or soreness around the lung, blurred vision or sensitivity to light, discharge from the eye, a feeling of something in the eye. A chalazion is a common eye condition that can affect people of all ages, genders, and ethnicities. It is most commonly seen in adults between the ages of 20 and 50, but it can also occur in children and the elderly. It is more common in people with chronic eyelid inflammation or blepharitis, as well as those with diabetes or other immune system disorders. People who wear contact lenses are also at an increased risk for developing a chalazion. A chalazion is caused by a blockage of the meibomian glands, which are located in the eyelid. These glands produce an oily substance that helps keep the eye lubricated and healthy. When these glands become blocked, the oil builds up and forms a lump in the eyelid, which is known as a chalazion. In some cases, bacteria can also cause an infection in the gland, leading to a chalazion. Treatment for a chalazion usually begins with warm compresses applied to the eyelid several times a day. This helps to reduce inflammation and promote drainage of the cyst. If this does not work, your doctor may recommend steroid injections or topical steroid creams to reduce inflammation. In some cases, surgery may be necessary to remove the cyst. This is usually done under local anesthesia and involves making an incision in the eyelid and draining the cyst. After surgery, your doctor may prescribe antibiotic ointment or drops to help prevent infection. The prognosis for chalazion is generally very good. Most chalazion will resolve on their own within a few weeks to a few months without any treatment. However, if the chalazion does not resolve on its own, it may need to be treated with antibiotics or steroid injections. In some cases, surgery may be necessary to remove the chalazion. In general, the prognosis for chalazion is excellent and most people will make a full recovery with no long-term complications. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinally.com/info. Be safe. Love you.